Hi, everyone. My name is Atharv Joshi, and today I'll be talking about physician engagement and health system transformation. So to get started, physician engagement is a broad term that has no singular definition. For the purpose of my research, physician engagement is a term that encompasses a physician's feelings or emotions regarding their interaction with the organization. There is growing evidence that suggests greater levels of physician engagement leads to better clinical performance in hospitals and primary care settings. It also improves the quality and safety outcomes for the patients the physicians treat. Ontario is currently undergoing one of the largest healthcare system transformations in decades, with primary care situated as a cornerstone of this shift towards a more integrated care. If implemented as intended, Ontario health teams, or OHTs, will be critical in improving health system coordination and enabling better team-based patient care. This will make primary care physicians, or PCPs, essential stakeholders in this transformation process. In southwestern Ontario, primary care providers formalized their network through the development of the London Middlesex Primary Care Alliance, or the LMPCA. This network became a key partner in the development of Middlesex London Health Team, MLOHT, as the abbreviation. It was previously known as Western OHT or WOHT and had no affiliation to Western University. The Provincial Connect Care Act in 2019 mandated OHTs to engage PCPs in this health system transformation. Through the OHTs, or Ontario Health Teams, care will be delivered in a more connected way by integrating interprofessional healthcare providers. For example, this includes providers of primary care, acute care, and mental health. So altogether, this will lead to more seamless and coordinated patient-centered care as seen in Figure 1. There's about 50 OHTs across the province of Ontario. Our region is the London Middlesex, as mentioned above. The key issues my project will be looking at is, despite the proven benefits of physician engagement, there is limited evidence on PCP engagement with Ontario health teams. With Ontario health teams being relatively new, the literature is limited in terms of understanding the grassroots relationships between the physicians of the OHT and the London Middlesex Primary Care Alliance. Even sparse is the knowledge available on primary care physician engagement strategies used within OHTs. Our study aims to find more empirical and qualitative evidence related specifically to primary care. Our study objectives aims to explore how PCPs can be effectively engaged in health system reform and what the best practices are in evaluating this engagement. Specific study objectives include exploring the development of a regional primary care alliance and exploring the engagement strategies used during system reform. So data collection will take place with physician members of the MLOHT, and we will use our association with the LMPCA to recruit our physician participants. The LMPCA network became a key partner in the development of the MLOHT, and our settings will take place at both locations of the LMPCA and WOHT. For our design and methods, a descriptive qualitative case study will be conducted using document analysis, focus groups, and interviews. Our work will be guided by the Vancouver Medical Staff Association Engagement Framework, which was created by Canada's Royal College of Physicians, as you can see in Figure 2. This project started with a literature review to explore the current PCP engagement strategies and evaluate best practices globally. We are in the next stage working with LMPCA, which has already expressed challenges engaging physicians, to create a detailed chronology or timeline of critical junctures or turning points of WOHTs and their PCP engagement activities. This chronology will lend itself into creating some key discussion prompts with our physician participants. We'll be using a semi-structured interview guide, interviews, and focus groups to conduct a richer contextual understanding of physician preferences when it comes to perceptions of engagement, as well as feasible strategies for potential evaluation. All qualitative data collected will be transcribed and coded using a thematic analysis approach, which has not been decided by our committee yet. Our anticipated implications for this project are understanding, improving, supporting primary care organizations' existing strategy for engagement, and by extension, improving patient care. We aim to contribute to the literature by providing a description of PCP engagement efforts in system reform, as well as a practical guidance for future PCP engagement and evaluation efforts. Thank you everyone for your time and listening to my presentation.